Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, brought to you by the Columbus Community Hospital. We're here in the Visiting Physicians Clinic, and I'm talking to Dr. David Rallis, and we're in the medical office building, but you are a dentist by trade, correct?
Yes, I'm an oral and maxillofacial surgeon. So.
And with all that, you're not just your neighborhood dentist. You do quite a bit of stuff. Can you kind of talk about the difference maybe between someone who has a neighborhood dentist and what you can actually all do?
Yeah, so our specialty is kind of a combination of medicine and dentistry. So our training involves dental school and medical school. So we have both medical and dental degrees. And we don't do what you think of as typical dentistry, more surgical procedures. So placing dental implants, removing wisdom teeth, putting patients to sleep for the procedure so they can undergo the procedure comfortably, doing facial reconstruction, so patients that have had trauma or have abnormalities of their facial skeleton.
Very cool. And talking about your schooling, so you graduated from Lincoln Southeast High School and then University of Nebraska Lincoln. Where else did your
I went to undergrad at the University of Nebraska in Lincoln, and then did my dental school in Lincoln at the University of Nebraska. After that, I went to the Mayo Clinic and did medical school, and then completed my oral and maxillofacial surgery residency. During that time, I did some residency in anesthesiology and general surgery as well.
Very cool. Well, what made you want to go into this field, and why did you decide to do all the extra schooling that it takes to do these kind of surgeries and stuff?
Well, I guess in dental school, I just enjoyed the medical part of things that I was learning as well, and the surgical part, so I thought it was just a great way to blend both of my interests in dentistry and medicine.
Very cool. And you're not always in Columbus. You spent a lot of time in Lincoln. So where is it at in Lincoln? Or why are you coming to Columbus?
So our office in Lincoln is at 56th and Normal. So it's pretty centrally located in Lincoln. But we started to see a lot of patients from this area, from Columbus and Norfolk and surrounding communities. So they were having to make the commute, and these patients are sedated most times. So it's a little bit hard to drive back an hour and a half after the procedure. Obviously they're not driving, but still, even riding in the car for that time after you've been put to sleep is a little uncomfortable. So we got the idea that we could better serve the community if we started coming up here. So now we come up here one day a week, and it's been great.
Very cool. You guys are in the newest part of the hospital here, but have you enjoyed working out of here, and what's your experience been like?
Oh yeah, it's been phenomenal. The hospital staff has been really supportive of us, and accommodated us so that we could have the times here that we needed, and the facilities that we need. The facility's phenomenal. It offers everything that we need to do our procedures safely, and I think very convenient for our patients.
Very cool. For some, you mentioned this a little bit, but if someone was going to need to see you, can you give me kind of an example of maybe what would happen if, hopefully nothing too bad, but why would they need to come in and see you?
I guess probably the bread and butter, the most common thing that a person would come see us for is a person that has impacted wisdom teeth. So you not have enough room for the wisdom teeth to erupt. Maybe they're starting to get some irritation or some pain around the wisdom teeth, and typically it's their dentist telling them at their routine visit when they're 17, 18 years old that, hey, you don't really have enough room for these teeth, they might cause you a problem. That's probably the typical patient that we see. Also, oftentimes people that have lost teeth because of trauma or because of an area of decay or an abscessed tooth that want to have it replaced with an implant would be the other common procedure that we perform here in this clinic. Other things would be people that have had accidents and had fractures to the facial skeleton, or perhaps a skeletal deformity where their bite is abnormal and they need to have their jaws repositioned.
Okay, very cool. Well, you guys have been here for a short period of time, since 2015, correct?
Yeah, just over a year now.
Okay, very cool. Is this something that you guys think you will be here for a while to come, staying in Columbus and operating out of here?
Yeah, we love it. It's one of our favorite days of the week to come up here. For me and all of my partners, I think, feel that same way. It's the community is very welcoming. Been very nice patients to take care of. The dentists that refer us patients here have been excellent. So we have no plans to really ever discontinue that.
Cool. If someone needs to get a hold of you, if they do need to come in and see you or your partners, how do they do that?
Our office phone number, I guess, rings to Lincoln. That's where we answer calls and make appointments, but then they just schedule them on the days that we're here in Columbus. Unless it's urgent and they need to be seen sooner, then sometimes people will drive to Lincoln.
Very cool. Dr. Rallis, thank you for joining me. I appreciate you sitting here and talking to me for a little bit.
Yeah, I appreciate it.
Well, thank you guys for joining us as well for another edition of Meet the Docs, brought to you by the Columbus Community Hospital. We'll see you guys next time.